morning, Miss Cherry Lou. I'm your nurse for today, Joanne Leslie Dasan.
Inspect general skin coloration. Keep in mind that the amount of pigment in the skin accounts for the intensity of color as well as hue. Individuals with fair complexions are at an increased risk for skin cancer. While inspecting skin coloration, note any odors emanating from the skin. Inspect for color variations. Inspect localized parts of the body, noting any color variation. Assessing skin integrity. Pay special attention to pressure point areas. Ear, scapula, and elbow. Palpate skin to assess texture. Skin is smooth and even. Palpate to assess thickness. Skin is normally thin but calluses, rough, thick sections of epidermis are common on areas of the body that are exposed to constant pressure. Palpate to assess moisture and temperature. Check under skin folds and in unexposed areas, and use the dorsal surfaces of your hands to palpate the skin. Palpate to assess mobility and turgor. Ask the client to lie down. Using 2 fingers, gently pinch the skin over the clavicle. Palpate to detect edema. Use your thumbs to press down on the skin of the feet, ankles, or pretibial area to check for edema. Inspect the scalp and hair for general color and condition. Natural hair color as opposed to chemically colored hair varies among clients from pale blonde to black to gray or white. The color is determined by the amount of melanin present. At 1-inch intervals, separate the hair from the scalp and inspect and palpate the hair and scalp for cleanliness, dryness or oiliness, parasites, and lesions. Inspect amount and distribution of scalp, body, axillae, and pubic hair. Look for unusual growth elsewhere on the body. Inspection and palpation of the nails. Inspect nail grooming and cleanliness. Nails are clean and manicured. Inspect nail color and markings. Pink tone should be seen. Some longitudinal ridging is normal. Dark-skinned clients may have freckles or pigmented streaks in their nails. Inspect shape of nails. There is normally a 160-degree angle between the nail base and the skin. Palpation. Palpate nail to assess texture. Nails are hard and basically immobile. Palpate to assess texture and consistency, noting whether nail plate is attached to nail bed. Nails are smooth and firm. Nail plate should be firmly attached to nail bed. Test capillary refill in nail beds by processing the nail tip briefly and watching for color change. Pink tone returns immediately to blanched nail beds when pressure is released.